Called RP6, and it may improve health care for critically ill hospital patients. Right now, the RoboDoc is on call at UCLA Medical Center in Los Angeles. He's making the rounds, or it's making the rounds, of the neurology department at ICU, checking in on patients with serious injuries. And Dr. Neil Martin is UCLA's Medical Center's chief of neurosurgery, and also Yulun Wang is the creator of RP6, the CEO also of InTouch Health. Gentlemen, good morning.
Good
to
morning.
both of you. This is pretty remarkable.
Good morning.
Good morning. Before we figure out why a hospital would want a robot, let's talk about how this would work. Dr. Wang.
Yeah, the way this works is it's called remote presence. It allows a physician to be in two places at once. As you see Dr. Martin here, he's sitting in his office at UCLA, but he's also here on the set with us at the same time. And so what happens is robotics combined with telecommunications allows us to create this remote presence capability.
And so he can control, Dr. Martin can control with a joystick 3,000 miles away from where we are all of what we're seeing here.
Correct. Dr. Martin is moving around his head much like you and I move around the head on our neck.
Okay. And Dr. Martin, how would you then, or how is this now, this technology being used to evaluate patients at UCLA Medical Center?
Well, we're not using it to substitute for care in person. We still do that in the usual way. But now when there's a crisis in the middle of the night, we can log in to the robot, beam right in, and talk to the nurse or talk to the patient right on the spot so that we can manage a crisis as if we were right there at the bedside.
So you're saying this would not be used and is not being used to replace doctor's visits normally in terms of going on rounds and that sort of thing. It really, you're saying, will increase the opportunity for people to get better care if it happens at times when doctors are not normally available?
Exactly. We can be in two places at once now. So if somebody's at home in the middle of the night, they can manage an emergency right in the intensive care unit without that lag time of having to drive to the hospital and be there in person.
Dr. Wang, you also say that one of the issues that's really facing the medical community today is that there's an increased demand for doctors being available. And one of the reasons why this is being exacerbated is the rising number of elderly patients?
Right. This country has an aging demographic problem where I think in about 20-25 years, 1 in every 4 Americans is going to be a senior citizen. And as we know, healthcare needs get higher as the population ages.
And this is a pretty cool technology, but what do patients say when one of these things come rolling into the hospital room? I mean, obviously you're creating a face-to-face with somebody in the hospital in the middle of the night who's having an issue. I mean, how do they react?
You know, it's funny. Everybody's always a little self-conscious or nervous when they first start talking to the robot, just like you were when you started talking. But as you engage with the individual face-to-face, eye-to-eye, then they forget about the fact that they're talking to anybody but their doctor. You know, what people tell us is they'd rather talk to their own doctor in the middle of a problem than talk through the robot than talk to another doctor that they don't know.
One of the issues, of course, people are going to say is that there is already this problem with the healthcare industry being sort of accused of being impersonal. And this doctor cannot touch and evaluate what's going on with me physically. So what's going to replace that, fix that?
Well, as Dr. Martin mentioned, this is not meant to replace the physician. It's meant to allow the physician to have yet another modality of communication.
He likes you. He's getting really close to you.
Yeah, Neil and I are good friends.
Okay, we won't talk about that. But in other words, it's supposed to augment and not replace.
Exactly.
All right, Dr. Wang, thank you so much. And also, Dr. Martin, nice to speak to you. A lot of fun.
Good to talk to you.
And good luck today on your rounds. All right, and we'll be back with much more of today after this.